Welcome to the deep dive. So you've given us this document. It's a Post-Aorta-Bifemoral Bypass Protocol.
hmm
Think of it as the essential playbook for getting through recovery after this specific surgery.
That's a good way to put it. This protocol, it's not just, a list of things not to do. It's really the roadmap for healing properly.
Right.
So our job here is to kind of unpack it, pull out the really crucial bits, the main things, so you understand the priorities for a good recovery.
Yeah. Because getting these details right isn't just helpful, it's like absolutely key, isn't it, for making sure things go smoothly.
Totally.
We'll touch on the immediate stuff, those strict rules right after surgery, then wound care, meds, and the longer-term picture, too.
Exactly. We're boiling this down to the need-to-know info, making these medical instructions, which can seem complicated, hopefully clear and actionable for you.
Okay, let's dive right in. Something that might jump out immediately is posture. This protocol is incredibly specific about how you sit, or rather, how you don't sit.
It really is.
Yeah.
And for a very critical reason. The number one rule for the first 2 weeks is absolutely do not sit upright.
2 weeks. Wow, okay. That sounds tough. Why is that so strict?
It boils down to protecting the new bypass grafts,
Yeah.
where they connect down in the groin area.
Mm-hmm.
Bending sharply at your hips puts pressure right on that fresh surgery. The protocol literally says, avoid bending the groin, hip, or wound more than 45 degrees.
45 degrees, okay. So if you have to sit.
That it has to be sort of slouching, leaning back about 45 degrees, and only for like 5 minutes max, maybe every 4 to 6 hours.
Right.
Really short periods.
Got it. So it's all about protecting the actual surgical work. What about other things, like getting around, daily life in those first 2 weeks?
Well, the protocol's pretty clear. No driving. If you have to be a passenger, keep your legs as straight as you possibly can.
Okay.
The big focus is rest,
Yeah.
avoiding anything strenuous. And another important thing, when you're lying down, get those legs elevated, above your heart level.
Oh, that helps with swelling, right?
Exactly. Reduces swelling, which is pretty common after this surgery.
And I notice hydration gets a specific mention, too.
Yes, definitely. Drinking enough fluids is highlighted. It helps reduce potential issues, and it's really important for preventing constipation.
Which can be a problem with pain meds and inactivity.
Precisely.
Okay, shifting from movement to the wound itself. Wound care, what are the absolute must-dos here?
Right. First rule, again, for those initial 2 weeks, no showering or bathing where the wounds get wet. Keep them dry.
Dry, so like sponge baths only.
Yeah, what they often call a bird bath. Wash carefully around the area, but the surgical wounds themselves must stay dry.
So how do you manage that? How do you keep them covered and clean?
The protocol says keep the wound covered with a waterproof dressing. It even gives examples like Mepilex border rag.
Okay.
These are special dressings designed to stay on, protect the wound. You need to change it every 3 to 5 days. After cleaning the wound gently with a sterile solution, something like Pronosan, or just sterile saline.
What if that dressing gets wet or soaked before the 3-5 days are out?
Yeah, very specific point in the protocol. If it gets soaked through, change it immediately. No waiting.
Mm.
And, crucially, call the consulting rooms.
So that's a flag. A soaked dressing might mean something needs checking out.
Exactly. It signals you need professional advice, just in case.
Makes sense. Okay, medications. Obviously crucial. What's the key message there?
Stick to the plan.
Yep.
Strict adherence. The protocol notes you'll likely be on an antiplatelet drug, think aspirin, maybe combined with a clopidogrel.
Blood thinners, basically.
Yeah, blood thinners to help stop clots forming in the new bypasses. And if you were already on something else like warfarin or rivaroxaban, you'd usually just continue that.
And your regular everyday meds.
Keep taking them. Your usual chronic medications for blood pressure, diabetes, cholesterol, keep taking them as prescribed.
Right.
And it mentions constipation again, saying a gentle laxative like Movicol is okay. But again, linking back to drinking fluids and calling the rooms if it gets severe.
And the protocol doesn't just give instructions, it also lists warning signs, doesn't it? Emergency signals.
Yes, super important. Contact the consulting room straight away if you have any problems with your legs or the wounds, or really any sudden change.
Like what specifically?
It calls out things like sudden pain, swelling, losing sensation, weakness, any weird discoloration, or bleeding in the surgical area or legs.
Okay. And there's a follow-up schedule, too.
Yes, a checkup appointment within 2 weeks is standard procedure.
So that covers the critical first few weeks. But the protocol also looks further ahead, right, to long-term success.
Absolutely. Long term, it really comes down to 3 main things. exercise, weight control, and quitting smoking.
Okay, exercise first. What's the advice?
Start slow, gradually increase your daily activity. The protocol specifically recommends walking, cycling, swimming daily if possible.
Why those?
They're great for strengthening your calf muscles and just generally improving circulation, which is, the whole point of the surgery.
And when can you ramp it up? Get back to a proper exercise routine.
Usually a full program can start after about 6 weeks, but always check with your doctor first.
Got it. And weight control.
Essential. Just vital for keeping good circulation and overall health long term.
And smoking. I imagine that's a big one.
Huge. It's presented as absolutely critical. Stopping smoking is key for the bypass to actually last. It even mentions getting help, maybe with meds like varenicline or bupropion if you need it.
And through all this detail, there's that one piece of advice that keeps popping up. When in doubt, phone the consulting rooms.
That really is the bottom line, isn't it? It's giving you permission, encouraging you to ask for help. Don't guess. Don't just hope it's nothing. If something feels off, call them.
So looking at this whole protocol, the strict posture rules, the careful wound care, the meds, the long-term stuff, it's not just arbitrary rules, is it?
Not at all. It's a carefully thought out plan. It's guiding your body's healing step by step, protecting the surgery, and really laying the groundwork for better circulation and hopefully better health down the line.
So as you think about recovery, maybe following these really specific, sometimes quite demanding instructions, here's something to consider. How does sticking so closely to this plan, especially in the short term, fundamentally change your path towards long-term health and, well, independence? What does committing to this recovery really say about resilience when facing a major health event?